The nurse is caring for a client who is receiving a transfusion of packed red blood cells. The nurse notes the client becomes hypotensive, tachycardic, febrile, and short of breath. Which of the following actions should the nurse take first? Be sure and drop your answer in the comments. Option 1, document the client findings. Option 2, notify the healthcare provider. Option 3, stop the transfusion of packed red blood cells. Option 4, continue to monitor the client's vital signs. Let's start with this question. We see the word take first in there. We're looking for our priority intervention. When we're talking about this question and the signs and symptoms we're seeing, it looks like this client's having a transfusion reaction. So we know our priority intervention is to stop that transfusion. We don't want any more blood going to that client. So our correct answer on this one is going to be option 3, stop the transfusion of packed red blood cells. The nurse is observing a staff member care for a client experiencing hypovolemic shock from a severe gastrointestinal bleed. The nurse should intervene if a staff member is observed. Go ahead and drop your answer in the comments. Option 1, establishing a second IV access with a 16-gauge catheter. For this question, it says intervene, so we're looking for the incorrect action. This is a correct action. When we have hypovolemic shock, we need to have multiple IV access so we can replenish fluid volume. Option 2, connecting the client to continuous cardiac monitoring. Again, this is a correct action. We need to monitor our heart for any dysrhythmias. Option 3, positioning the client in the high Fowler position. This is our correct answer because this is an incorrect action. When we have hypovolemic shock, we want our heart to be perfusing our vital organs. We don't want it to fight against gravity if our client's in the high Fowler position, so we want them reclined in a flat position. Option 4, initiating rapid transfusion of 0.9% sodium chloride. Again, this is a correct action, so an incorrect option. We want to give IV fluids, blood, anything like that to replenish our circulating fluid volume when we have hypovolemic shock. So our correct answer is option 3. The nurse has taught a client with iron deficiency anemia. Which of the following menu selections by the client would indicate a correct understanding of the teaching? Be sure and drop your correct answer in the comments. Option 1, scrambled eggs with orange slices. Option 2, lentil and black bean stew. Option 3, tomato soup with grilled cheese toast. Option 4, peanut butter and banana sandwich. All right, let's look at this question. So the question says correct understanding. So we are looking for the true statement, the true option here. When we're talking about iron deficiency anemia, we're looking for foods that are going to be high in heme iron. So our correct answer on this one is going to be option 1, scrambled eggs with orange slices. That's going to be our combination of foods with high heme iron, which is our eggs, and orange slices, which helps to absorb that iron better. The nurse is assessing a client with suspected aplastic anemia. Which of the following findings would support a diagnosis of aplastic anemia? Select all that apply. Be sure and drop those answers in the comments. Option 1, thrombocytopenia. Option 2, hypoglycemia. Option 3, neutropenia. Option 4, polycythemia. Option 5, hyperlipidemia. All right, so let's talk about this question. First, we see select all that apply. That means that we're going to have more than one right answer. Now let's talk about aplastic anemia. Aplastic anemia is a condition that causes myelosuppression or pancytopenia. That means suppressed elements of our bone marrow. So what we're going to see is decreased red blood cells, which is the anemia part, decreased white blood cells, which is the neutropenia part, and decreased platelets, which is thrombocytopenia. So our correct answers on this one are going to be options 1, thrombocytopenia, and option 3, neutropenia. The nurse is teaching a client with sickle cell disease about lifestyle modifications to prevent episodes of acute pain. Which of the following statements by the client would indicate a correct understanding of the teaching? Select all that apply. Remember, select all that apply means you're going to have more than one right answer. Be sure and drop those answers in the comments. Let's walk through this. Option 1, I should avoid exposure to large crowds. Again, we're looking for correct understanding, so we're looking for true statements. This is a true statement when we're talking about sickle cell. Sickle cell, especially episodes of acute pain, happens when those sickled red blood cells that we get with sickle cell clump together and cause ischemic pain. So things that can trigger those episodes can be infection, so that's why we want to avoid exposure to large crowds. Option 2, I should continue walking and practicing yoga daily. This is a true statement, so a correct answer. We want to continue moving to promote circulation. Option 3, I will increase my fluid intake in warm temperatures. Dehydration is another trigger for sickle cell, so this is a true statement and a correct answer. Option 4, I may require hospitalization if I develop an infection. Again, going back to those triggers for those acute episodes, infection is one that can cause those acute episodes of pain. So we may require hospitalization for medication to help with infection, but also to manage that pain. Option 5, I will experience more mild symptoms in high altitude locations. This is an incorrect statement, so a wrong answer. High altitude can trigger episodes of acute pain. So our correct answers on this one are options 1, 2, 3, and 4. Thanks for stopping by. Be sure and check out the link in our bio for more information.